the Raw Take, everyone, the lifeline to your unfiltered media experience. I'm your host, Gian Thomas, and before we get into the show today, don't forget to like, comment, and subscribe, and hit that notification bell so you don't miss out on any uploads. Also, you can find us anywhere where you can listen to podcasts. So, last year, in the year of 2020, the USA had the most drug overdoses ever recorded. We had around 93,000 deaths in overdose. That's wild. That many people losing their lives to drugs. I mean, what has happened with the war on drugs? As we can see, the war on drugs has gotten worse because whenever America does war, the problem gets worse. It gets exacerbated far beyond than what we wanted. They had a uptick of 21,000 deaths from the previous year. That's on average during 2020, just from drug overdoses alone. That's 256 people dying a day. That's just to drug overdoses. That's not because of the pandemic. That's because of drug overdoses. Man, and it's mostly affecting the younger generation. I had a couple of people in our community last year. I knew that they had overdosed, and it just goes to show that the pandemic exacerbated so many issues, just made so many things worse. We had, just the loss of jobs, the loss of opportunities in 2020, that isolation, not being around people, all of that contribute to people turning to drugs, people not being happy, people not knowing what to do, people not knowing how to face their situations. And so they turn to drugs. And not to mention, 3/4 of the deaths came from prescription drugs. 3/4 of the deaths came from prescription drugs. That is your doctor basically killing you. What kind of stuff is that? And this is kind of a little side note, but I wanted to put this statistic in here because it's in the article that I was reading. The drug overdoses has upticked 450% since 1999. What was going on before 1999? That we didn't have drug overdoses like that. Before, in the year 2021, we have a 450% increase in drug overdoses. The Iraq War, Afghanistan War, going over there for war for minerals. Not including all the opium production. Just something that we was mentioning on one of our latest shows. There's a correlation, people. There's a correlation. You cannot make this stuff up. Before 1999, when we wasn't in Afghanistan in the Middle East, it was below 450%. But after the war, after we've been over there for 20 years, and now we have an uptick. Coincidence? I think not, people. Wow. But anyway, I just can't believe that in the richest nation this world has ever seen, that we are not having some kind of program to help combat this. How we don't have, I know we have drug programs all around the world, but this is a crisis. There's an opioid crisis. It's past what our communities can do. I mean, our communities can help, and local businesses and treatment centers and things of that matter, they can help. But we are at a crisis. We need the government to step in. We need the government to stop letting Big Pharma give them money so they can continue to drug our kids. I mean, that's one of the main things we need to do. We need to rail in Big Pharma. because they are passing out these pills like Skittles. And it has shown to get our people addicted. And I'm not saying, when I say people, I just mean, people in general. I mean, since 1999, a 450% increase in drug overdoses. That's wow. In 20 years, we've had more than a 200% increase. That's a problem. And with the job loss, the pills constantly being pushed, this is only going to get worse. People are going to turn to substances to escape reality because things are so bad. Because people don't understand. People think that people just turn to drugs because I want to do drugs. I smoke weed now. Now I want to go do drugs. That's not even how it works. People break a leg. People break an arm. People have surgery, and they get hooked up on these pills. That's how it gets started. Don't try and blame marijuana for being a gateway drug when you got doctors passing this stuff out like Skittles. When you don't need this stuff. You need some kind of type of painkiller, but prescribing people stuff like fentanyl and these high doses of opioids, that should be on your deathbed. If you're going through major surgery, you don't need that stuff. If you fell and bruised your leg, here's some Valium, here's some Vicodin. People don't need all that. That's for chronic illnesses. Oh man, y'all, the most powerful nation in the world, and we're poisoning our own people. That's how you have to look at this as. That is all this drug crisis is, this opium crisis is. It's pharmaceutical companies poisoning their people. And we got to stop it. And so many people, people need their medicine. So, and then you don't want to get into the habit of trying to self-medicate because, am I going to take this? Am I going to take that? It gets very muddy. And then you can have people missing out on doses because we already have people trying to harvest their medicine, and so they won't run out of it because prescription prices are so expensive. So you already got people rationing their medicine. Now you're going to have people rationing their medicine even more. Our system does not care. And then I want to add this. There's a little historical context. It's an opium crisis. But when it was the crack era and crack was destroying our neighborhoods, it was violent crime and it's just the way that we are handling the opioid crisis, because we're still not doing anything. But I do see there being more of a push and more advocacy for the opioid crisis than what there was in the 80s with the crack pandemic and the crack crisis. They jailed black men and women for crack cocaine. But now with the opioid crisis, you need help, you need treatment. The black people needed treatment too. But y'all tried to criminalize them. But it's a little different with the opioid crisis. I just wanted to throw that in some people's ears. See how they treat us. How it's two different worlds. It's completely two different worlds. But that's our show, everyone. Don't forget to like, comment, and subscribe. And hit that notification bell so you don't miss out on any uploads. Also, you can find us anywhere where you can listen to podcasts. Have a blessed day.